Dad.
Hey, what's up, bud?
What happens when your kidneys fail?
What happens when your kidneys fail?
Yeah.
A lot of things. So the first thing you guys got to understand is that the kidney's main purpose is to regulate your blood's fluids and electrolytes. So whenever you drink too much water, your kidneys excrete the excess fluid, and whenever you consume too much of a particular electrolyte or too little, your kidneys regulate the filtration. Either they keep or they excrete by urinating the excess amount of electrolytes. So when we talk about these electrolytes, I'm talking about sodium, potassium, calcium, phosphorus, and magnesium. There's other ones, and those are also affected, but those are the 5 ones that I want to focus on. So when somebody has kidney failure, the kidneys shut down, the GFR changes. The GFR stands for the glomerular filtration rate, and that talks about how much blood is passing through your nephrons every minute. And the average is about 100 mLs per minute. This is not to be confused with the amount of fluid or urine that your kidneys are creating every hour, which is 30 mLs per hour. The kidneys, when they begin to fail, you develop oliguria, a decrease in urine output, and all of the substances that your kidneys normally filter out, they stay in your system. So things like creatinine, which is a muscle metabolite, things like urea and nitrogen, which are elements from metabolism when you consume foods, primarily proteins. All of that waste is supposed to be excreted by your kidneys. Your liver helps out too. And so when you have kidney failure, all that stuff stays inside your system, so your creatinine goes up, your BUN goes up. Now the GFR that I was mentioning earlier, the amount of blood that's passing through your kidneys every minute, that goes down. And usually anything less than 40 mLs per minute constitutes as end-stage renal disease, like you're gonna die, because your kidneys are not functioning. So there's 2 types of kidney failure. You have chronic kidney disease. This is usually a long-term issue where your kidneys slowly lose their filtering ability, and eventually you develop end-stage renal disease, which your kidneys are shut down and you need dialysis, right? You also have another type called acute kidney injury or acute kidney failure. That happens when you consume a substance that shots out your kidneys or shoots out your kidneys and they suddenly stop working. That's what happens when you consume metformin and contrast medium at the same time. Both the contrast medium and the metformin, when they enter your bloodstream and they get filtered by your kidneys, they cause them to shut down, and that's why it's important to hold metformin for 24 to 48 hours before and after any procedure that requires a contrast medium. Anyways, so as your kidneys fail, your sodium goes up, hypernatremia, your potassium goes up, hyperkalemia, you develop hypermagnesemia, you develop hyperphosphatemia, but the calcium, it's a little bit different. Your kidneys, they go through something called, and vitamin D as well, by the way, it goes through something called hydroxylation. This is the process of activating vitamin D so the calcium in your system can increase so it can be utilized by your system. But when you have kidney failure, since the kidneys are responsible for that process, they can't do it anymore. So your calcium cannot be activated and it cannot go up. So you develop hypocalcemia, meaning all of your electrolytes go up except for calcium. That one goes down for the reason that I just described. And that is why you have to be careful with increasing vitamin D, increasing calcium in the diet. And because phosphorus and calcium have an inverted relationship, and phosphorus is the one that dictates that relationship, you have to decrease the phosphorus in the diet. And remember that all phosphorus is found in animal products, including milk. So you're gonna decrease that substance in the diet for the patient. No meats, because it contains that phosphorus that's gonna continue to push calcium down. And in essence, that's what happens when somebody has kidney failure. Patients also develop fluid retention. They develop darker pigmented skin, but not like a cool tan. It looks ashy. It looks not well hydrated, because all of the deposits of the waste that's in your bloodstream, or all of the waste that's in your bloodstream, it gets deposited into your skin, and you develop a different skin pigment, and you just look really sick. And so in a nutshell, that's what happens when your kidneys fail.